Hello, my name is Allison and I'm a nursing student with Nightingale College. Today I'm performing the oral medications video submission. So the 6 rights for medication is the correct patient, correct drug, dose, time, route, and documentation. Okay, so I'm just going to look at the EHR and look at what the doctor has ordered for my patient. And I noticed that they had prescribed metformin 500 milligrams, amoxicillin 250 milligrams, and Benadryl 25 milligrams, and then acetaminophen 500 milligrams per ml. So I'm going to gather all my medication, which is here, and then also just compare it, making sure I grab the right stuff, compare it to the EHR. Metformin 500 milligrams, amoxicillin 250 milligrams, Benadryl 25 milligrams, and acetaminophen 500 milligrams per 15 ml. Okay, so I have everything that I need. I've gathered all my supplies. I'm gonna knock on my patient's door, wait for their permission to come in, close the door and or curtain behind me. Hi, my name is Allie. I'm gonna be your nurse today. What is your name and date of birth? Okay, I'm gonna check their wristband. Okay, Mr. Smith, the doctor has ordered some medications, so I'm in here to help you out with taking those. Do you have any questions yet for me? No? Okay, perfect. Do you have any allergies that I should be aware of, including medication? No? Okay, awesome. I'm going to perform hand hygiene and put some gloves on. All right, Mr. Smith, this should only take really about like 5 minutes. It should be really quick. Okay, so the first thing I'm going to grab. All right, Mr. Smith, here we have amoxicillin. I'm checking with the EHR. Yep, amoxicillin, 250 milligrams. This is our antibiotic. Okay. This can cause nausea and diarrhea as side effects. Some adverse side effects can be wheezing and hives. If you experience any of the adverse side effects, please let me know right away. Some of these can be very serious, so just let me know. The next one we have here is metformin, 500 milligrams. This is to help regulate your blood sugar. There we go. All right, perfect. Side effects that you can experience with this is also diarrhea, but also decreased appetite. Some of the adverse effects can be abdominal pain. Here we have Benadryl, 25 milligrams. This is for your allergies. This can cause drowsiness and dizziness. Some of the adverse side effects to look out for are urinary retention. Do you have any questions for me at this time about your medication? No? Okay, so we are going to go ahead and take these. Are you in a comfortable position to take these? Yeah? Okay. Do you want to take one at a time or all 3 at once? He wants to take all 3. So we're going to go ahead. I'm going to give him the medication. Okay. Let's wash it down with some water. And then I'm just going to watch my patient, making sure he gets his medication down, looking for any sort of choking or any effects right away. All right, are we good? Okay. Also, Mr. Smith, I was wondering, what's your pain today on a scale from 0 to 10, 10 being the worst? A 7. Okay. So yeah, we can go ahead and give you some of this acetaminophen, 500 milligrams per 15 mLs. This will help you with some of your pain that you're experiencing. Some of the side effects are dizziness and nausea, and some adverse side effects that you could experience are black tarry stools and jaundice. So just let me know about those. So I just mixed up my medication. I'm going to cover the label with my hand, so in case there's any spillage over the side of it, it doesn't get all gross and messed up. And then I'm just going to find the lines. I might get to eye level with it. Just going to pour out 15 mLs. Perfect. I'm going to wipe the top so it doesn't get gross. I'm going to put the cap back on. And then here you can see. 15 mLs. Okay. Hi, Mr. Smith. Here is your acetaminophen, 500 milligrams per 15 mLs. Do you have any questions before we take it? Are you in a comfortable position to take it? Okay, let's go ahead. He can take his medicine. You want to wash it down a little bit. All right. Get it all down safely. Okay, Mr. Smith, do you have any other questions for me at this time? Are you in a comfortable position? Perfect. All right, here is your call light. I'm going to raise up your bed rails for your safety. If you ever need anything, just go ahead and use your call light. I'm more than happy to come in and help. At this time, I'm going to be cleaning up my area and getting ready to go. Any last questions? No? Perfect. Okay. I'm going to take off my gloves after cleaning up my area. I'm going to use some hand sanitizer for hand hygiene. I'm going to document everything that I did, correct patient, drug, dose, time, route, and correct documentation. Closing the door and or curtain behind me for privacy. Thanks.